Welcome to this edition of In-Depth Alaska. I'm Tracy Sinclair. On Sunday, an explosion at a bonfire on Kodiak burned 3 teenagers. To help us better understand what that sort of recovery could mean, investigative reporter Johnson Kuhn spoke with one of the state's top burn doctors. Dr. Elisha Brownson couldn't speak about the teens' specific recovery, but helped us understand what the physical and mental recovery process is like.
Let's just sort of discuss what that recovery process looks like for individuals who undergo second-degree burns that would be on par with what we've seen kind of coming out of Kodiak.
So acute burn injury focuses on several aspects when the patient is hospitalized, including acute burn wound care and the need to monitor if they require skin grafting, a focus on therapy with range of motion, focus on pain control, and then also psychosocial recovery. Those things are our focus early on, and depending on the burn size and also the location of the burn dictates how long a patient is in the hospital. In general, for every % of your body that you've burned, you end up spending about a day in the hospital. And so that can help us guide patients and families for the road ahead on recovery after burn injury.
Can you kind of, for the viewers at home, sort of help put in perspective, I mean, someone in that situation, what are they kind of going through mentally, physically? I mean, what does that kind of look like?
Burn injury is a really complex injury that affects both the patient and their family, and not only has a really high pain component, but also they're trying to heal wounds and also deal with the psychological trauma from the incident, but also the appearance of their new body and healing and possibly scar from that. So it's something that our team here at ANMC really does a multidisciplinary approach. So it's not just the surgeon and the nurses performing wound care, but we also have physical therapy, occupational therapy, psychosocial support to really help the patient and the family go through that in a successful manner. Everybody's journey on burn recovery is very different, and the way that they respond to that is always unique to the patients. So we have to adapt and help them on that road, but those are some of the general focuses that we have.
And speaking with the superintendent, one of the things that she had mentioned is, the staff there is trying to prepare themselves to learn how to help students as they return. So I would imagine there's a certain amount of that for families in a situation like this as well. What kind of things do you, whether it's advice or just information, do you pass along to families to try to help prepare them as their loved one kind of returns from a situation like this?
After burn injury, the initial focus in the hospital really, especially if it's a large burn, is on survival. And then that focuses next to function and eventually cosmetic outcomes and rehabilitation. We talk a lot about return to school, work, community, and burn injuries are very visible. They're our skin. And so patients with burn injuries, burn survivors, get a lot of questions asked for them. So as we're getting closer to discharge and return to community, we talk a lot about helping burn survivors field those questions and also appropriate accommodations when they return to work or school. Again, it's a very visible injury, and so a lot of us are curious and ask questions, and there's a mental kind of preparation for dealing with that.
Certainly. Can we talk a little bit about the advanced tech that I'm told is sort of utilized here?
So I'm the only fellowship-trained burn surgeon in the state, and Alaska Native Medical Center is the highest level trauma center in the state, a level 2 adult and pediatric trauma center, and we do have burn capabilities. We've been building these capabilities. We've been a trauma center for over 25 years and have been building our burn capabilities for the last 8 years that I've been here. Not only do we have skin grafting, but we've also brought up some newer skin technology, including something that is similar to like a spray-on skin that avoids large donor sites and allows patients to heal faster. It's something that we can use for both second and third degree burn wounds, and has really shown an advantage as we've used it this last year in Alaska to help patients recover quicker and have less scar and less pain.
Interesting. So if I'm understanding that correctly, that's sort of cutting back on a process of like removing skin from another area to replace, skin grafting. It sounds like that's sort of eliminating it.
Yeah,
sorry, go ahead.
Yeah, sorry. Traditional skin grafting is taking a piece of the patient's skin from an unburned area and replacing it onto the burn wound. We can do what we call a mesh skin graft, where that spreads out so you don't have to take as much donor. But with what we call epidermal autografting, essentially spray on skin, we take a very small, about the size of a credit card, of their own skin at a very thin layer, thinner than usual. That gets morcellated into a special solution and can be sprayed onto a very large area of burn wound.
And am I understanding it correctly when you say that's sort of a unique process to this facility in particular?
We're the only center in Alaska doing this particular type of skin grafting right now. We collaborate with Harborview Medical Center down in Seattle, Washington. They are the regional burn center. But at A&MC, we have a real passion for keeping burn injuries here in Alaska that are appropriate, so small and moderate sized burns. And that way, patients and families can recover in their own home community and stay closer to home.
Okay. And you mentioned Seattle. In a hypothetical situation, I mean, with this being such an advanced facility for burns, I mean, what sort of a scenario would have to exist for someone to not be able to receive treatment here and would need to go on to Seattle for, a more advanced treatment?
Burn injuries that may need to go out of state include some specialty burns or large size burns. At Alaska Native Medical Center, we have the capability to care for small and moderate size burns up to about 30% of someone's body surface area. And we are able to provide specialty care for some of the advanced burn injuries, such as burns to faces, hands, and also burns to children.
Okay. This might be kind of a silly question, but I wanted to ask. I know you had mentioned that each person's road to recovery, if you will, is sort of an individual situation, case by case. But I wouldn't imagine so. But I'm just curious. Does age ever factor into any of that as well? Or if you have second degree burns, it doesn't really, age doesn't really factor in terms of your recovery process and how you handle that.
The physical aspect to recovery is very age dependent. So extremes of age have harder times, so very young children and elders. Youth are the best healers. So bigger children, teens, young adults will be good health, have good nutrition, and they rapidly heal. So that's definitely an advantage.
I'm so glad I asked that.
There's no silly question.
No, it's always the question I think is going to be the worst always ends up being the best. So that's a lesson I need to learn. Is there anything else that you feel like would be important to say? Any message to the public, whether it's offering, safety advice, anything along those lines that we might not have touched on?
I think that one message is youth are at higher risk for flame injuries, and this cross-sects with a time when youth are less supervised by adults and are sometimes engaging in more risky behavior. And so things like being exposed to open fires or impulsive activities can lead to burn injury. And so it's just an important conversation for parents to have with their kids, to know how to behave around open fire and to make sure that that kids are well supervised when there's access to fire. Burn injuries in kids are really common, and if we can prevent them, that's the best thing that we can do. But when burn injury happens, our center is here to care for the kids from acute burn injury all the way to recovery and rehabilitation.
That raises another quick question. So, I mean, I would imagine you have numbers immediately in front of you, obviously, but in terms of percentages of who you tend to see more come in with burn patients come in, they tend to be more within like the teen range, just because of what you said, that risk factor?
Mm-hmm. You want me to wait till after the overhead announcement?
Sure.
Alaska sees about a little over 100 patients a year that are required to be hospitalized either in Alaska or Seattle for burn injury every year. About a third of those are pediatric patients, 0 to 18. In kids, we tend to see very small children, 0 to 5, that get injured with scald injuries, so hot water spills or hot baths. And then the adolescent age is where we're seeing more flame burns.
Okay, great. John Perry, you got any questions?
Yeah, I mean, are you able to comment about, especially with the children going through treatments like this, and you mentioned you've seen, I guess you've seen patients of similar ages, go through this recovery and everything, are you able to touch on the psychological aspect at all, or, they're physically, their appearance was affected, but then, once they go through this treatment, what have you seen in that regard to how that helps them, psychologically
Mm-hmm.
dealing with this traumatic event?
So the incident of where the burn happens can be very traumatic. So a lot of fear is around that, maybe fear of being around flame or heat sources again. There's the fear of feeling like they were going to die. That's something that is definitely we have to deal with. Then once they get through the shock of that, the questions I get often is, what's my scar going to look like? Am I going to have a scar that looks like this or that? And that's where we have to spend a lot of time. Children especially, we want them to have perfect cosmetic outcomes. And so I get a lot of questions both from children and adolescent burn survivors and their parents about what the final outcome is going to look like. That is hard to tell. It takes months for us to really know where burn scar and pigment ends up. But that's hot on people's minds when they have these injuries is, what's my scar going to look like? Am I going to have a scar? Other things is functional mobility. Am I going to be able to play sports, play the piano? Am I going to be able to walk normally, use my hands? So those are the things that are on people's mind is function and cosmetic outcome. And that's what, having burn specialty here, even after discharge, I follow all kids with burn injuries for at least 2 years to monitor their scars and their function and make sure that we've got a good outcome.
Do you have are there counselors, specialists that sort of also come in and work with people?
We have child life specialists, so they not only help with kids just adapting to hospital life, they're integral in our wound care. So they're distracting the kids and doing therapeutic play to help the kids, not be scared when they're going to wound care or a treatment room where they're going to get a procedure. So that's super helpful. And then we have behavioral health specialists that are going to help with the psychosocial recovery. They're also, in the case of children with burn injuries, they're available to the parents because we realize that this is a pretty big shock, and there's a lot of support that needs to be held with the parents as well.
Yeah, what do you tell the parents? Because I would imagine from day to day, the moods of patients are up and down.
Mm-hmm.
What do you sort of tell parents to not just be prepared for, but how to handle addressing or talking to their kids?
For large burn injuries, I tell families this is a marathon. This is not a sprint. This is take care of yourself because this is not a quick in and out of the hospital. Burn injuries just take more time because of the all the different things we have to do with healing and therapy and psychosocial recovery and pain control. So that's a long hospital stay more than breaking your arm. The other thing I tell parents is that this is going to be a roller coaster. There's going to be bad days, but the trajectory is always going up. And so if we look at where we were a week ago, we're better off. But there's going to be days when you're feeling great, you overwork, and then you have a lot more pain and don't feel like talking about things. Those bad days are going to happen, but we want to see a general trajectory towards healing and discharge. Oh, the other thing I was going to say is I mentioned that we have a little over 100 burn patients in the state.
Yeah.
Over the last 2 years at least, Alaska Native Medical Center is admitting half of those. So,
oh, yeah?
Yeah,
Okay.
so our burn volumes have actually increased. And again, the burn team is not, it's a team, and we have the specialty care that the nursing and therapists and everyone is providing.
And with that increase, it's more kids around fire specifically?
The increase the number around the state is slowly increasing. We are increasing how many we're able to keep in Alaska because the growth of what we're able to do for burn care.
Oh, I see. So it's
the percentage here.
You're just taking right.
Yeah.
Okay.
But I say all the time, it doesn't matter where you're from in Alaska. People have contacts in Anchorage. It's a lot easier, even if you have to be flown for an injury to Anchorage, you have a lot of connections, maybe family members, definitely friends. You've been to Costco in Anchorage. It's a more familiar place. And we really this is a long-term recovery, and we want this to be as easy as possible in a way that is giving quality care. And that's why we're passionate about keeping all Alaskans that are appropriate to be able to have their burn care in Alaska.
Thanks for listening to this edition of In Depth Alaska. Please like and subscribe to this podcast.